I'm Mark Espeland. I'm a professor of gerontology and biostatistics at the Wake Forest School of Medicine in Winston-Salem, North Carolina. I'm happy to be here to talk about associations between tobacco use and risk of dementia. There's compelling evidence from many studies that smoking increases the risk of cognitive decline and possibly and probably dementia. Heavy smoking in middle age may double the risk for dementia later in life. And there's also very strong evidence that quitting smoking reduces risks, even to levels comparable to those that have never smoked. The Lancet Commission in 2020 was assembled to evaluate which modifiable risk factors should be targeted most effectively to reduce the risk of dementia. I was looking to see if this risk factor was targeted, what would be the impact on dementia later on. In this figure, you can see that among those risk factors that could be targeted later in life, they felt like the most important would be smoking, that it might have more of an impact than targeting depression, social isolation, physical activity, air pollution, and diabetes. Quitting smoking is very important towards reducing the risk of dementia. Compared to adults that continue to smoke, those that quit smoking long-term reduce their risk of dementia by 14% and have comparable risks to those who never smoke. This reduced risk is both for Alzheimer's disease and for vascular dementia. Smoking more heavily increases risks. A metric of this is pack years of smoking, which is the number of years that one person smokes times the number of packs per day. So 20 years of pack smoking would be equivalent to a person smoking 1 pack of cigarettes a day for 20 years. There's some evidence that each additional pack year of smoking increases the risk for dementia by 1%. So that individual with 20 years of pack smoking will have increased their risk of dementia by 20%. And this association may be complicated because, of course, smoking increases mortality, so that some smokers may die earlier, even before the onset of dementia, that would have occurred later on. And of course, it's well known that smoking can shorten one's lifespan, and some of this increased risk of death is attributable to an increased risk for dementia, which leads to an early death. Sidestream smoking, exposure to tobacco smoke, is particularly an issue with younger children and adolescents. Those that are exposed to tobacco smoke early on are at increased risk for cognitive and intellectual deficits, reduced vocabulary, lower reading scores, early grade retention, and lower scores on tests of planning and attention. So in summary, there's strong evidence that smoking increases risks of dementia. Smoking cessation can reduce these risks, even among individuals that have smoked for much of their life. Environmental smoke exposure may adversely affect cognitive development in children and adolescents. Appreciate this opportunity. Thank you.